Autism Spectrum Disorder, Myths and Facts. Autism Spectrum Disorder, or ASD, is a neurodevelopmental disability that affects how people communicate, socially interact, and behave. ASD is a spectrum of neurodiversity that can vary widely from person to person. The impact these differences have on an individual's functioning also varies widely. ASD can affect people of all ages, backgrounds, and abilities. Person-first language, for example, saying a person with autism, has often been used to separate a person from their condition. However, there is mounting evidence that the autistic community prefers identity-first language, for example, saying an autistic person. This language highlights that autism cannot be separated from the person and is an aspect of a person's identity that they may take pride in. Hi, I'm Dr. Beth, and I'm a pediatrician at SickKids. In this video, we will explore some common myths and facts about ASD. Myth 1. There is an autism epidemic. Some people think that ASD is a new or rapidly increasing disorder. Fact 1. ASD has always existed, but the fact that we are better at recognizing and diagnosing it may be one of the contributing factors to the increase in prevalence. ASD is not a new disorder. It was first described in the 1940s, but it has likely existed for much longer. More autistic people are seen today because screening methods, diagnosis, and awareness have all improved. The criteria for ASD diagnosis have also been expanded to include a wider range of symptoms and abilities. This means that more people who were previously undiagnosed or misdiagnosed can now receive the services and supports they need. Myth 2. Vaccines cause ASD. Some people believe that vaccines, especially the measles, mumps, and rubella, or MMR vaccine, can cause ASD in children. This is not true. Fact 2. Vaccines are safe and do not cause ASD. Vaccines are one of the most effective ways to prevent serious and sometimes deadly diseases. They are rigorously tested and monitored for safety and effectiveness. There is no scientific link between vaccines and ASD. The myth was based on a published paper that was later retracted. The author of this paper admitted that he had made up details and the studies were deemed to be fraudulent and data was misrepresented. In fact, many studies have confirmed that there is no link between vaccines and ASD. Vaccines do not cause ASD, but they can protect children and others from harmful diseases. Myth 3. ASD is caused by poor parenting. Some people think that ASD is a result of poor parenting, or that parents of autistic children are cold, distant, or neglectful. This is not true. Fact 3. ASD has many possible causes, but poor parenting is not one of them. In the 1940s, Leo Kanner, a psychiatrist, described mothers of autistic children as refrigerator mothers. The stereotype of a cold, uncaring parent who caused their child's autism has brought enormous pain and guilt to many families, and it was never true. The cause of ASD is multifactorial, meaning that there are many possible causes, including genetic and environmental factors. Parents do not cause ASD by their actions or attitudes. Parents of children with ASD are often loving, caring, and supportive, and they play a vital role in their child's development and well-being. Myth 4. ASD only affects boys. Some people think that ASD is a male-only disorder or that females cannot have ASD. This is not true. Fact 4. Females can have ASD, but they are often underdiagnosed or misdiagnosed. ASD affects both boys and girls. There is a 1:4 female-to-male ratio with ASD diagnosis, although it is thought that some girls are not being diagnosed as their symptoms present differently than in some boys. Some girls may also mask or hide their difficulties better. Myth 5. All children diagnosed with ASD are the same. Some people think that all autistic children experience the condition in the same way. This is not true. Fact 5. ASD is a wide spectrum, and no two children with the same diagnosis will appear the exact same way. Each autistic person will have their own unique set of strengths and challenges, and the degree to which these differences affect their daily lives can also vary widely. There can be some autistic people who need regular close support to get through their daily tasks, whereas other autistic people may need no to minimal or intermittent supports. Myth 6. Autistic people do not feel emotions or like to socialize. Some people think that autistic people are emotionless, aloof, or antisocial. This is not true. Fact 6. Autistic people do have emotions and socialize, but they may express emotions and experience or engage in social interactions differently. Autistic people have emotions just like anyone else. They can feel happy, sad, angry, scared, and everything in between. However, they may have trouble understanding, expressing, or showing their own emotions, or recognizing or responding to the emotions of others. They may also have difficulty with social cues, eye contact, body language, or tone of voice. This can make them seem uninterested, rude, or insensitive, but that is not their intention. Autistic people do want to socialize and form relationships, but they may have different preferences and boundaries for social interactions, such as needing more time alone or avoiding loud or crowded places. Myth 7. ASD gives people savant or genius abilities. Some people think that all autistic people have extraordinary talents or skills, such as a photographic memory, a mathematical prowess, or a musical gift. This is not true. Fact 7. Autistic people have a range of abilities, just like anyone else. Many autistic people have average or above average intelligence, though they may also have learning difficulties or an intellectual disability. Many autistic people have restricted patterns of interest and may exhibit a relatively high degree of knowledge or ability related to that specific interest. A small percentage of autistic people have savant skills. Myth 8. Autistic children should only attend separate special needs programs. Some people think that all autistic children should be segregated from their peers and placed in special education classrooms that cater to their needs. This is not true. Fact 8. Autistic children benefit from inclusive education that respects their diversity and potential. Autistic children have the right to access quality education that meets their individual needs and goals. This may include mainstream or special education programs, or a combination of both, depending on the child's abilities and challenges. While there is no one-size-fits-all education plan, research shows that inclusive education or inclusive opportunities, which involves learning alongside neurotypically developing peers, can have positive effects on the social and/or academic outcomes of autistic children. Inclusive environments can also foster acceptance, understanding, and friendship among children of different backgrounds and abilities. Myth 9. You should try to stop an autistic child's repetitive behavior. Some people think that repetitive behavior such as rocking, flapping, or spinning are abnormal or harmful, and that they should be stopped or discouraged. Fact 9. Repetitive behaviors can be a natural and functional part of ASD. Repetitive patterns of behavior or interests are a common feature of ASD. They serve various purposes, such as expressing emotions, coping with stress, stimulating the senses, or focusing attention. They may be a way of self-regulation and communication. They are not harmful unless they interfere with daily functioning or cause injury. Trying to stop or prevent repetitive behaviors can be stressful, frustrating, or even traumatic for autistic people. Myth 10. Autistic children cannot become independent adults. Some people think that autistic children will never grow up to be independent, productive, or successful adults. This is not true. Fact 10. Autistic adults can live fulfilling and meaningful lives with the right support and opportunities. ASD is a lifelong condition, but it does not mean that autistic people cannot achieve their goals and dreams. Autistic adults may need different types of support throughout their lives, such as education, employment, housing, transportation, or healthcare. Many autistic adults can live independently, work, study, socialize, and contribute to society. ASD is a complex spectrum of neurodiversity that affects people in different ways. There are many myths and misconceptions about ASD that can lead to misunderstanding, stigma, prejudice, or exclusion. By learning the facts and listening to the voices of autistic people and their families, we can increase our awareness and understanding of ASD and promote a more inclusive and respectful society. I hope you found this video helpful. Subscribe and visit aboutkidshealth.ca for more. Thanks for watching. Stay healthy, everyone.